Actually, Nina Elkadi, and the format of tonight's town hall is different than what it was going to be, because what I tried to do is to have a balance between a politician and often a journalist or somebody who's interested and engaged with rural healthcare issues in some ways. And unfortunately, Jim McGovern, who is my congressman and one of the most politically powerful congressmen in the Democratic Party, he is stuck in the Rules Committee and therefore is unable to join. So we will go on without him. So tonight, what we're going to do is feature the second speaker, who's Nina Elkadi, and I'm going to hand it over to her in about 30 seconds. She's a remarkable woman. I've actually just met her for the first time. I've read a lot of her work, and I reached out to her. So I really feel very, very lucky. And then after that, what we're going to do is have a conversation about the MAHA movement and voters, and to see what's real and what's not real, and just to ask people's opinion and to say what I think we can possibly do. But before I introduce Nina, the last thing I want to say is about Ask Nurses and Doctors. It's an 8-year-old organization, and the mission of which is either to help candidates or incumbents who have a positive aspect of health reform to get elected. And we also work on health legislation. We work on a number of states. We're excited about the November elections, and that's who we are at Ask Nurses and Doctors. Now what I'd like to do is introduce Nina Elkadi. She is a wonderful journalist, and I hope you subscribe, as I have subscribed, to her Substack. So that's one of my pitches for Ms. Elkadi. And she, broadly speaking, and then we're going to go into more details, she explores corporate influence within the agricultural industry, the environmental impacts of factory farming, and how this negligence impacts consumers and workers, and how it affects our health. And so what I'd like to do is hand it over to Nina, Ms. Elkadi, and thanks for being on.
Yeah, thank you so much for that very kind introduction. I'm really excited to be here. I'm no Congressman McGovern, so I feel like if you were getting excited about that, I understand why. He's such a big personality. So I'm going to do my best to just come in with what I originally had planned and hopefully keep you engaged for as long as you wish to be engaged. But as Norbert said, I'm a journalist reporting primarily on agriculture, water, and public health. I'm originally from Iowa. Any other Iowans in the crowd tonight? Nope. That's usually how I get people warmed up. There are never any Iowans, and then we get to make a little joke about how few of us there are. But I originally got into these issues by honestly being from Iowa, and some of you may know, and I'll talk about this a little bit in my presentation, that Iowa is the state with the fastest growing rates of cancer right now. There are a lot of people guessing and doing research into why. I'll talk a little bit about that in my presentation. But I've really come at this story through the angle of water pollution primarily, which is what I'm going to discuss tonight. And since it's a little more casual, smaller group, and we have a little bit of time, if you have any questions or things you'd like me to talk about, just feel free to put them in the chat. Norbert and Stephanie, does about 10 minutes of a presentation work well? Okay. Let's do that. So I made some slides. Can you all see those? Yes, great. Okay, perfect. So as I said, I'm going to be talking about water pollution primarily. And the type of water pollution I want to talk to you all about is something called nitrate pollution. I know PFAS and a lot of forever chemicals are in the news right now, as they should be. These are really important problems. I think a question I'm often asked is what is being overlooked? I would say nitrate pollution in terms of rural communities and what they're facing healthcare wise is one of the big ones. And I'll tell you all about what that is as I go through here. But I think it's helpful to kind of ground it in maybe one initial story so you get a sense of my style of reporting. This is a piece about a 10,000 head proposed cattle feedlot that was to be located in the northeast corner of Iowa. That part of Iowa, sounds like none of you are from there, but maybe you're familiar with the state, is what's known as karst topographically. Has a very thin layer of topsoil, has these beautiful, if you're a fisher person, naturally reproducing trout streams, kind of unlike anything you've probably seen or think of when you think of Iowa. And a lot of people who recreated on this stream were trying to fight the feedlot that would be located at the headwaters, because a feedlot obviously creates a lot of manure. That manure has to go somewhere. Typically it's sprayed on nearby fields, or, you know, if an animal poops, the poop might get into the groundwater pretty easily when there's not that much topsoil. So if you want to check this piece out, I reported it for a publication called Civil Eats, which I'd highly recommend if you're interested in rural issues that are related to food and agriculture. But I'll tell you what ended up happening, which is that the residents were really on it. They were going to community meetings. They were appealing the Department of Natural Resources, saying this is going to compromise our waterway. And to make a very, very long story short, there's a state senator whose son-in-law owns the feedlot. And the way that these activists were getting the data that the stream would be polluted in certain months when agricultural activity was heavy, they were using sensors that were funded by the University of Iowa. There's another name, if you're interested in these issues, I'll put on your radar. His name is Chris Jones. He's a former water engineer who's running for Secretary of Agriculture in Iowa on a clean water message. Maybe keep your eyes peeled for a piece from me on that in a national publication in a few weeks. I digress. So Chris is the one running these sensors, right? State senator, this is all reported on already. I'm not spilling any secrets here. State senator says that he's going to defund the water sensor network unless Chris stops writing about the potential impact on this stream. Chris takes the retirement, the water sensor network gets defunded anyway. And the reason I wanted to bring that up is because I think this is a really important story in showing that community members, one, really care about their waterways, their health. They are, especially in Iowa, at least from my reporting, I feel like people notice when their neighbors are going to put in a giant animal operation and typically are not happy about that. But there are a lot of other factors at play in the state of Iowa that kind of run very deep. And I don't think this is a unique story to Iowa, but just something I wanted to frame this with. And those activists are they're still keeping the pressure on and doing their own water testing of the stream. All right, sorry, that was a big long story that I tried to condense down, but I encourage you to take a read if you're interested in more. So all of this really comes back to that there is a lot of poop in Iowa produced by millions and millions of animals. These really tiny stories here, I'm sorry that they're very small, but they are about the 110 billion pounds of manure that are produced annually in Iowa, and the fact that currently the Department of Natural Resources, according to some former employees and other people in Iowa, is not really tracking where that manure is going. So that obviously comes back to my first story, because if you don't know where the manure is going, how can you necessarily, say who is to blame? This is just a systemic issue. It's a lot easier to kind of disperse the blame amongst the general, the general manure producing animal population, right? It's a lot more difficult to pinpoint if you can't say this is where the nitrogen is coming from. So all back to my whole nitrate slide, the first slide, to make I assume maybe some of you have a science background. I am not a scientist, so I just want to preface what I'm about to say. But to put it in very, very simple terms, if something like manure or nitrogen-based fertilizer goes through the soil and does not all get taken up by those plants or crops, and a lot of farmers do tend to over-apply fertilizer because there are no penalties for doing so. And it's kind of like insurance, right? If you apply a bunch more, maybe there's a heavy rain, you'll still be good to go. That will eventually convert into nitrate, and that can cause blue baby syndrome to infants and babies if they're exposed to high levels of nitrate in their drinking water. This is mostly through drinking water that we're seeing concern for public health. There have also been more studies that have come out in the past few years on the link between nitrate and certain types of cancers, colorectal cancer being one of them. Obviously, it's very difficult to prove causation, especially with something like cancer, but I'll talk a little bit more about that. Another story I reported on nitrate pollution in particular, and now we're getting to how this affects rural residents outside of just something like fishing or recreating, is a lot of people are on wells, right? Private wells in rural areas. And I spoke with this farmer, Jeff Broberg, and the EPA limit of nitrate in drinking water, quote unquote, safe drinking limit. I don't know if we want to go down the whole pathway of if all EPA limits are actually safe or not. I think that's also up for debate with nitrate right now. It's 10 milligrams per liter. So Jeff measured his well. It's going up and down from around 8.6 to 22. And so he had to install his own pretty expensive reverse osmosis filter. If you all have water filters in your house, maybe you have decided that's something that you want. You might know that reverse osmosis is one of the most expensive types of filters. It's the one that can filter out nitrate pollution, unlike a Brita or a carbon filter that could filter out PFAS. Those kinds of filters can't filter this. So yeah, this is a story about the rising costs that rural residents face because of that. So one of the most recent pieces I did on this was about this really small town called Early, Iowa. And Early has about 500 residents, and they also were facing really high nitrate levels in their municipal drinking water. And I went on Google Earth, Google Maps, and saw that their wells are essentially right up next to a cornfield, which is not unusual for Iowa. Maybe now your more typical thought or vision of Iowa is coming to mind, which is, you know, a lot of corn and soybeans. And manure is sprayed on that corn. Corn is very nitrogen hungry, so it needs nitrogen-rich manure or synthetic fertilizer. And in Early, their nitrate levels were so high that they couldn't give their community clean drinking water. So what they ended up doing is they installed a very expensive reverse osmosis filter, but it wasn't working because to run the filter, you needed a lot of water. And Iowa has been experiencing drought for the past 4 or 5 years. So this story to me really kind of brings it all together, that this is an issue that is obviously changing due to the changing climate. You can have these solutions like a filter, but the filter only runs if there's enough water. So if there's drought, then what do you do? And that these small towns are really facing steep costs. The cost falls on the ratepayer. So they were able to get a loan from the state to install the filter, but ultimately they need to pay back that loan. So local utilities rose. And I went on Iowa Public Radio to talk about this, which is that bottom left. And I can follow up with Norbert with links and such if you would like. But I interviewed, sorry, there's a bad word on this slide, but that's what the guy said. So I feel like it's actually worth including. So I spoke with John Livermore, a resident of Early, and I saw that he had been commenting on Early's Facebook page saying this happens every summer, something's got to give. And so I said, when I interviewed him, I said, you know, what am I going to do? And he said, I'm trying to leave because that's ultimately what he thinks is going to be the best thing to do for him and his family. And there was also this added layer to the interview, which is that the city would go through periods of saying, you know, the water is not safe to drink. And then a few weeks later say, oh, the problem is fixed. now the water is safe to drink. But he was developing some trust issues, right? He thought, what if I drink the water and then a day later they say, actually, we shouldn't have consumed it. So he was starting to buy bottled water. And yeah, he had some choice words, as you can see here, but also choice words about, his local government. Really difficult situation. And kind of what I ended the story with is that, John could move somewhere else. And if he feels that's what's best, I think, of course, he should. I'm not the person to make a judgment on that. But I was thinking that in a lot of small towns in Iowa, they're facing very similar issues. So there's a chance that he moves to a neighboring small town and they will have some of the same issues. So I just threw a lot of information at you, and I do want to end this. Okay, well, before I end it on a happy note, I'll end it on a political note, since I know you are all interested in politics as well. About a year ago now, on the cancer issue in particular, was curious how state officials were discussing cancer and what causes cancer. And I submitted a records request to the head of the Iowa Cancer Registry, which each year creates this report about some topic in cancer. Okay, so I found an email, and I don't think this is, a damning email or anything. I actually just really think it's interesting that the director of the Cancer Registry wrote to Senator Chuck Grassley, so oldest senator in Senate, my senator, that, quote, as you can imagine, has been a tricky road to alert Iowans about our high cancer risks and try to focus on mitigating the known risks while navigating the barrage of knee-jerk reactions many people have about it being due to chemicals in the water or the pesticides, nitrates, etc. And when I reached out to her, she clarified that they're not dismissing the potential agricultural links, but we're also really trying to inform the general public that there are lifestyle changes as well. And the reason I actually added this slide is to say that there's a tension in Iowa right now, I think, between all experts. Everyone's an expert in this field, but between those who are saying, we need to try to control what we can control, which are behavioral risks, cancer risks. And I'm not speaking at all for what I think this person is prioritizing or not, but I do think there is some hesitancy to say that it could be caused by agriculture, or that the biggest industry, over 80% of all land in Iowa is covered with crops, could have some connection to all these health issues. Good news, there's a lot of organizing going on in the state. Rural residents are, there's just a lot of action right now around clean water. A new poll came out a few weeks ago that said the second most important issue to Iowans right now who are voting, that is not the cost of living, which is the most important issue, I think, for a lot of people across the country, is water quality. It is a really hot topic right now. I think people are concerned, and people are looking for information, which is where I try to come in. So I'll stop talking now. And do you have any? Oh, yes. Already, should I just take the first question, Jeffrey?
Go for it.
All right.
Yeah, thanks very much for the presentation. It's very informative. I'm wondering whether the Iowans are seeing the problems as primarily local or state or federal. How do they view this politically?
Yeah, that's a great question. Well, Norbert, I didn't know you were going to bring in the MAHA stuff, and I don't know that I'm the person to talk about that. But I will start by saying I think most people are turning to their hyper-local officials. So like county supervisor, mayor, especially if it's something that they think is being caused by, say, one feedlot in town or one group of farmers. Then there's also been a lot of pressure on the governor to do something. She invested, I believe it was about $1 million last year for cancer research, which was a pretty big deal. I know that's not a lot of money, but it was a pretty big deal for her to do that. And if you are interested in politics, it's going to be a really hot year in Iowa. We have a Senate seat up for grabs. Joni Ernst, famously, who said, "We're all going to die," is not running for re-election. And the people who are running to replace her are being asked a lot about water quality and cancer. And then we're starting to see some connections, Norbert, as you brought in, to the Make America Healthy Again. There are people who are looking to, at one point, I think we're looking to RFK Jr. for more regulations on this stuff. So sorry, I kind of went all over the place with your question, but I think they're turning to everyone, but starting hyper local.
Other questions from or comments from anyone else? Because otherwise I want to ask a couple questions myself, but if there's some, I want to turn to the audience. Nancy? Do you want to
Unmute, I think.
Yeah.
Oh, yes.
So thank you so much for your comments. And I want to reflect on one of your senators. Senator Harkin was extraordinarily on top of this when he was on the Ag Committee in the Senate and in the House. And the two things that he did, and I just want to, as we look through this, one of the things that is important that I believe he started was the healthy orientation of our diets and our food assistance programs, and did a lot to ensure that our food assistants would follow the dietary guidelines. And he also worked very hard to ensure with others in Iowa that you had and I can't remember what the footage is, that you had back from the streams so that you could not apply pesticides within a certain space. So, you know, that was a bipartisan support that went through the Iowa Assembly, if that's what it's called. So I think there are some past history lessons that can be useful in appreciating that this has been a bipartisan approach. And I do think that one of the things we can do with the MAHA and the focus on nutrition is that the improvement of the nutritional well-being can really help one protect against certain cancers, or help us get our immune system against it. It can't cure them, but it's certainly an important part of it. So I do think from a political viewpoint in Iowa, there's some real connection there that is, again, not a Democrat or a Republican issue.
Yeah.
Thank you.
Absolutely. Yeah. And I'll put, so actually something you all might be interested in if you're bringing up Senator Harkin is he ended up donating his papers to Drake University, which is a small private college in Des Moines, and founded an institute there called the Harkin Institute. And they have a couple different subject matter areas. And one of them is actually, I believe it's agriculture. But they came out with this report actually about agriculture and cancer. So I'll drop a piece I just wrote last month in the chat. But yeah, Senator Harkin has been putting a lot of his money toward that now.
Billy Milwee asks a question. How big an impact do you see with the controversy around glyphosate, given Trump's executive order and so forth? So I'm wondering if you have any comment on that.
Yeah, I think that pesticides are actually how I got into all of this work initially. I think the controversy around glyphosate is bringing a lot of people into this who are looking for answers, who maybe were not engaged prior, because there is so much national attention on it. I think with what I was saying about John Livermore, that resident of Early, who is feeling mistrust with his local government, I think a lot of people are maybe feeling mistrust with their national federal government. I don't think that's a wild thing to say. But even people who maybe weren't feeling that mistrust generally are feeling it around something like glyphosate, where they're wondering, you know, if the science was maybe ghostwritten by the company, why has the government told me it's safe? I think a lot of those questions are tying back to, yeah, the same theme.
Thank you. Any last questions before I ask my quick questions? I don't see more. Feel free to chime in at some point soon. Before I ask you the questions, I want to say I don't think anybody is an expert on MAHA. So I think there's a lot of noise that's going around it. And so as we get into that topic, which we will in the next couple minutes, I just want to emphasize that I don't believe that we really have a deep understanding of who these MAHA voters are, other than what's clear to me is that there are many different segments of them. And so I'll just say that, and then we'll get into it. I just want to add two quick questions for you. Maybe you could just tell us a little bit about some of your current writing projects that haven't been published yet, just to get a little preview of some of the work. So that's my first question, and then I have a last question for you.
Sure. Well, when is this recording going to be posted? No, I'm just kidding. But I am working on an investigation, actually, and this isn't confidential, but about a JBS. JBS is one of the big four meat packers in the US. Owned brand that is popping up grocery stores. I don't think there are any in Mass, Norbert, but if you have people around the country, they're not titled JBS grocery stores. They're titled something else. I'm working on that. And then I'm also, this is more, you'll be some of the first people, I guess, to publicly hear this, but I'm going to be starting an MFA in the fall at the University of Iowa to work on a book about a lot of this stuff. So that's something I'm really, the wheels are turning.
Wow, so exciting. So what a pleasure to have you. And we'll certainly hope to, continue to learn from you and to be engaged with you. My last question is something that a variation on a question that I ask virtually to all our participants. And so you don't have to, if nothing comes to mind right away, not to worry, but I'm sure something will come to mind. But the bottom line is the vast majority of your projects are on very serious topics. Could you tell us any funny stories from any of your writing projects?
Oh my goodness. Well, the funny things usually happen like on the way to the project or, right after. But when I was last year, I was reporting a story in La Paz County, Arizona, which is very rural Arizona, about alfalfa and how the alfalfa industry there is kind of running rural residents' wells dry. And on the way there, my photographer and I rented this big SUV, and my first reporting trip in a while. And we pull into this local church and are standing there just chatting with each other. And she goes, "Do you hear a hissing sound?" And I'm not a big car person. I was like, "I don't know. I can hear something, but I don't know for sure." And we're standing there and the hissing is just getting louder. And she turns around and feels the tire of the car, and it was deflating rapidly. And we're really in nowhere, Arizona. And I say that as an Iowan, like it's just desolate out there. So anyway, 1 hour into this reporting trip, we book it to the tire shop, make it just in time. We're like chugging along, trying to make it there. I don't know if it's funny now. It wasn't too funny then. It's type 2 fun, where you look back and you think that was funny, but yeah, that was a good memory. We bonded too, and it led to, I think, better reporting.
Absolutely. It's a great story. And again, it highlights for me in terms of the work that you and I are doing, which is very different, but at some point very similar, which is to say these are difficult issues, is what I always say is that if you're not having fun in some ways in doing this, don't do it. So I'm going to say it again, but when we end. Jeff Lerner has another question, and then we're going to go into the MAHA whole debate.
Yeah, I did wonder and I know this is a general question, but is it possible for you to characterize how a lot of Iowans in these rural areas are getting general information about politics? Do they care about it, and what are their sources? Now I realize it's, going to be varied. So I'm trying to think of it in terms of how Iowa might be different from New York City.
Yeah. I think a lot of people, Facebook is alive and well. In rural communities, it is really the way that a lot of people get information generally. So actually that story about early Iowa, Livermore, they post a lot of their information about if water is safe or not to drink on Facebook. I mean, for a lot, and they also post it in the town hall, but more people are going to Facebook daily than they are the town hall. And so I know a lot of people get their information through Facebook. Oddly, Substack has, and it's actually why I'm on there. In Iowa, there are a lot of people that are turning to Substack. I think it's a way for people in rural areas to feel like their small community, has a voice in a landscape where there's very little local media now. And then the radio, I would say. So AM radio and also FM radio, but talk radio and also the news.
Thank you. Great question. Thanks for asking that question, Jeff. So what I'd like to do now is sort of not so much switch gears, because we're really, and this is an extension of the topics that you've been raising, which is why having you and Jim McGovern would have been ideal, because of course, as you know, Jim McGovern is very interested in agricultural issues and food and nutrition issues. So that I want to kind of give some just a few seconds of background, and then ask for people's ideas on this important topic. As we do that, I just want to highlight, in terms of Ask Nurses and Doctors, that we have a whole new look to our website. We have an active Facebook page. We have an active LinkedIn page. We have an active Substack. Please consider looking at all of these, and please consider engaging in all of these. So I want to just read a couple. There's been quite a few articles just in the last month about the whole issue of different types of MAHA voters. And I just want to read a couple quotes, and then I'm going to open it up for comments, and I'll have one very specific comment myself. These voters are politically desirable across party lines. So this is from an article in Politico. Some of MAHA's priorities, such as getting rid of petroleum-based food dyes or limiting pesticide use, are widely popular. About a third of independent parents, along with 1 in 6 Democratic parents, identifies as supporters of the MAHA movement, according to a poll from late last year. Many Democrats are also trying to win over disaffected MAHA moms. The most prominent MAHA moms tend to be swing voters rather than Trump loyalists. Vani Hari, an activist known as the Food Babe, was a delegate to the Democratic National Convention in 2012, but is now a prominent MAHA influencer. So that's one point that I want to say. Secondly, about half of independents, 51%, and swing district voters, 50%, say MAHA is not delivering on its promises. More than 1 in 3 voters, including 33% of swing district voters, do not support the MAHA movement. Voters prefer candidates with backgrounds in science and medicine over those aligned with the MAHA agenda by more than a 15-point margin. By the end of the survey, every tested group decreases its favorability of RFK Jr. most by double-digit margins. So it seems to me, as an opening kind of comment, that our best bet to try to help elect individuals who believe in science and believe in limitations on some of the issues that you brought up, and then I'll ask for your comment and then everyone else's comment, is for us to really focus in part on vaccines, in part on water quality and pesticides. And if we can hammer that home with trusted messengers. So the question, when we talk about ask nurses and doctors, it's not just healthcare professionals that we're talking about, but it's the broader definition of healthcare professionals. So I'm wondering if you have any comments on that, Nina, and then really open it up to the floor for comments on, you know, maybe there's going to be others who, for example, there was an article just in the last few days in the Atlantic magazine, which said, which argued that in fact, MAHA voters are not available. You know, that these people are really fundamentally MAGA voters first, and then MAHA voters secondarily. But it seemed to me that you were identifying in your stories people who could potentially be influenced to vote for people who believe in science, as really is the essence of what Ask Nurses and Doctors is all about. So I'll start with you, Nina, and then open it up for anyone who wants to comment.
Yeah, that's really interesting. Thanks for all of that. I think the primary thing that I'll say is over the course of my reporting, I've really felt like people are aware of what is going on around them. That sounds so basic to say, but if they see their children getting sick, their parents getting sick, people they went to high school with, let's say they're young, getting cancer, that is notable to them. And I think that going way back to the beginning of MAHA, which wasn't that long ago, feels like it's been a lifetime. I think that the issues around pesticides and public health, that RFK Jr. was speaking to people who feel like they haven't been spoken to by anyone before in politics, whether that's true or not. And so I think that clearly these issues are important to people across the country.
Thank you. So I'd be interested in opening it up to the floor, you know, to anybody who would like to speak on the topic. Specifically, I'm particularly interested, but obviously it's really the whatever topics are of interest, is that how do we apply this to the November elections, and then go from there. So the floor is open. And it's not required to have any comments. You know, this has been great. I want to thank, as I'm waiting for people to hopefully raise their hand, I want to just, first of all, again, thank you, Nina, for your excellent work. And we're really lucky to have you. So thanks so much. And we'll start with Jeff, and then we'll go to Billy.
Okay. So to respond to your question, Norbert, do you think that the science argument can be made in a way that would persuade a swing voter simply because if you can relate it to a person's health, and presumably that's what's behind MAHA, that if it becomes personalized, and I'll give you an example. Suppose you want to talk about a subject that's obscure politically, genetic health, you know, funding science for genetic research. Okay, that sounds obscure, but if it's done in a way that talks about, you know, children with some genetic disease, that kind of thing, or you know, it doesn't have to be a child, but children are always appealing. Would that be the kind of thing that would be a persuasive way to approach these swing voters, assuming the MAHA people are swing voters and are interested in healthcare as a really central issue?
Anybody can comment on that. Do you have any opinion on that, Nina? You don't have to.
I don't know. I think I'll listen and chime in as I think about it.
See, I think the one thing I'll say, and then we'll go to Billy. One thing I'll say is that I don't think, that's why I highlighted specifically vaccines. You know, that's something that appears to be one that many people resonate with. I want to just highlight for you, just as an example, that just today, Governor DeSantis in Florida had his medical freedom bill shut down, at least for today. We'll see how long that lasts. But it was shot down because people, the president of the Florida State Senate has two young kids in school and did not want his children to be exposed to all the people who are unvaccinated. So I think that we have to slice up, the issues, and the one that appears to be resonating is the one about vaccines. The second thing that I would highlight, and then we'll go to Billy, and then if Nina at any point you want to jump in, I think the issue of water quality and pesticide use, it should be a winning issue. The question is how to make it so that people can relate to it. Or maybe we don't have to worry about it, and we just have to say that this really depends on the congressional district, and try to get healthcare professionals engaged, who are in that congressional district on the water issue. And in another congressional district, it may just be the pesticide issue. So I think, maybe it's got to be sliced and diced, with an overarching issue of the vaccination issue, which I think definitely has some potential. Billy, and then Nancy Chapman Cole. Billy?
Yeah, kind of an observation, I guess, more than a question, but it's always intrigued me that with MAHA, it relates to both the left and the right. On the extreme left, you have people who are opposed to vaccinations and identify strongly with a lot of the MAHA principles, and you have the same thing on the right. But it's something that, in my mind, MAHA should be owned by the left rather than the right. And the reason I say that is just witness that most recent executive order that Trump signed on the active ingredient in Roundup. I mean, to me, it was a complete betrayal of the whole MAHA movement. You had Bayer, Monsanto, I'm sure, came in with a lot of political contributions and were able to manipulate that. So it seems to me that's a message that could be exploited, that MAHA is serious on the right only if it involves changes to the food pyramid, but they're going to take this seriously, particularly if they have to go up against industry and well-funded lobby efforts. And maybe the left can capitalize on that and be a little bit more sincere. I kind of see it as a really insincere way that Trump brought RFK in to get that small number of voters that he brought in that are turning out to be influential. And with that, I'll stop.
Nina, you're highlighting something in the chat.
Yeah, just a super quick comment because I want to hear Nancy's comment too. But just regarding the Defense Production Act and glyphosate, Naomi Oreskes, who was my undergraduate thesis advisor, you may know her as the author of Merchants of Doubt. So she called for the retraction of the glyphosate paper that was retracted in December. And just to Billy's point, I think there is a disconnect, right? Because to actually stop some of these problems from happening, I think some people would argue you need government intervention and regulation, which isn't really the thing of this administration. So then if that can't happen, how will it happen? And I think that's the tension that, as you said, we're seeing play out right now.
Well, my only observation about this administration is that they are happy to have regulation and engagement on the topics that they're interested in. So there are all sorts of, I'm going to have a piece on LinkedIn that will come out on there's a proposal that EPA start tracking any quote unquote wastewater pertaining to abortion pills, mifepristone, and any other aspects pertaining to abortion. So I think this administration is more than willing to engage in regulation as long as it's on issues that they're particularly politically committed to. Nancy? Then David has a comment.
Yeah,
Question.
just a real quick, a couple observations. One, MAHA began in California. And, you know, because of the way and the focus on nutrition was really important in that area. And so I think we can, I mean, it's, you know, I think RFK is known more for his vaccines, but certainly his commitment to changing the food supply is something that I think is important, and it's universal, and mothers care. I mean, they really care about their kids' ability to stay healthy. And, you know, I think the vaccines and the power of moms has turned that around. I also want to compliment physicians' role in this vaccine, and many of them in local areas have taken to media and have testified. You know, these are pediatricians that talk about their caseload. So one of the things I think that is really important is not as much argue the science, is argue the experience of the physician and nurses in what they're seeing and how it used to be when this happened, because I think that's one of the things that is easy for people to relate to, is clinical practices and their own experience with their family. I think somebody said that. The other thing in terms of the nutrition area, I think this is something that is becoming very universal. And whether it is a healthy school meal, which is, I mean, there's a lot of conflict. And I think, Billy, you mentioned it with the dietary guidelines. Dietary guidelines came out the way they were because of the high influence of dairy and the meat industry. And that was part of a bargain a long time before the guidelines came out. And that's been something that they've had pressure on the Ag Committee for a while. But I don't think that that's a universal view. I do think that moms understand more. And I think this is somewhere, again, where physicians, nurses, dietitians, other people that are in that field can make some very important messages that can be local. Right now, the most critical issue that is important is the ability to afford healthy food. And it is the one thing that separates those people that have health because they can afford it, whether they can pay a good healthy meal, they can pay for an exercise program, or they can even, you know, get to the grocery store, whatever it is. So I think that this affordability and the food and healthy diets is a winning, I think, in elections for sure.
Well, it's important. It's Jim McGovern. This is music for Jim McGovern's ears, because that's been his mantra, and that's also music to Ask Nurses and Doctors' ears, because that's the whole premise. That is that healthcare professionals are trusted messengers, especially if they're local, you know, local healthcare professionals. And I had patients today. I had 2 patients who were food insecure. We, as it turns out, we have access to food in the office, both food vouchers and food in the refrigerator that we can give out. So it's the food insecurity issue is significant. It's a pleasure to see David Auerbach's face, who I've spoken with over the phone over the last few months. So it's a pleasure to meet, see your face, and look forward to hearing.
Hello, Norbert. Hello, everybody else. Yeah, a few comments. The one problem is that the science of nutrition and nutrition recommendations, those studies are very difficult to do, notoriously, and no doubt partly because of that. It just comes to mind several sort of scandals where researchers indeed turned out to be funded by one industry or another. That was not made public. I'm pretty sure I recall one at Cornell. I believe another one at Harvard over the past decade or so. The other thing is that I'm looking at an article that's published on Substack by a physician writer, the pharma shill paradox: who actually profits from vaccine mistrust. I mean, there are huge profits to be made by anti-vaxxers. There's a long-standing historical connection between the right wing and sort of snake oil salespeople. I'm pretty sure Paul Krugman has written several columns about that over the years. And so, the accusation that moral people, vaccine advocates are in bed with the pharma industry. Again, it's another example of what every accusation is an admission of something. And I just wanted to mention that a lot of money to be made in anti-vax, anti-science, regrettably, but there is.
Yeah, that's been unfortunately and tragically amply documented. And I think we have to, my perspective is that we have to, as much as possible, stick to the science, be effective communicators, and keep on repeating the message. And it seems like, at least to some extent, it's beginning to have an impact. So we'll just have to see. Are there some last comments or questions that people have? Otherwise, I'm going to give Nina a heads up that I'm going to ask if you have any last comments that you'd like to make, and then I'll make a very brief comment myself. Any last comments? Those of you who know me is that I try to start on time, but I always end on time, if not a little bit early, and I'm always happy to end a little early. Nina, do you want to make any last comments?
It's funny because as a journalist, that's always the question I ask people. Is there anything I didn't ask? And I wasn't prepared for it. Well, I just want to thank you all for being such an engaged audience. This was a great conversation. And yeah, I'll hope to stay connected. My Substack is called Corn Belt Confidential. So if you want to look me up on there, it's free. Just click the free button. I'll be posting more this summer and into the fall. So thank you for having me.
Well, but I want to give another ad. I'm a paid subscriber, so I encourage people to be a paid subscriber to Nina's excellent Substack. So it's definitely, and we especially these days, in terms of my contributions, my biggest contributions are actually to journalists of one sort or another. And the reality is we need journalists like Nina. So it's an honor to spend this hour with you, Nina. I want to hopefully hear from many of you and different ideas and different races that we can work on together. As Stephanie, who's from the A&D team, she just put in the chat our new website, which is the same address, but it's got a completely different look, and we encourage you to look at it. Look at the work that we're doing with respect to Substack and LinkedIn and Facebook. I'm glad to hear about Facebook. That's something that I can understand. I'm glad you didn't highlight too much about TikTok because I don't know anything about that. So thank you so much to everybody. Have a great day and rest of your evening. And I look forward to hopefully seeing you next month with both a politician and another journalist. Thank you so much for joining tonight. Bye-bye now.
Bye.